The laparoscopic sleeve gastrectomy is my favourite weight loss operation. It's the modern version of stomach stapling. It's performed with keyhole surgery. Most people stay for a couple of days before going home, and we're getting excellent results. Most patients can expect to lose 60 to 70% of their excess weight within 6 to 9 months. And if you have a BMI within the 40 to 45 weight range, you have a reasonable chance of getting down to your goal weight. The younger you are, when you have the surgery, the more likely it is that you get close to your goal weight. And certainly we have maybe half a dozen people who have achieved that in the last year. Part of the reason why it works so well is most people after sleeve gastrectomy don't feel hungry. There are thought to be two reasons for that. First of all, the part of the stomach that we remove produces a hormone called ghrelin that makes you feel hungry when your stomach's empty, and also your stomach empties faster, so the food that you eat gets through to the end of the gut quickly, and the body then sends a feedback signal to your brain to say you've got enough calories in and you don't need to eat anymore. That's why people tend to lose weight so rapidly and generally don't feel hungry. Your diet is more normal with a sleeve. Your anatomy isn't changed, you just eat smaller amounts. It's felt to be particularly good for men because men tend to have issues with portion control, whereas women have a slight tendency to do more eating of chocolates and desserts. It's a set and forget operation, so you don't need to come back for checkups as regularly. I like to see you 3 weeks after your surgery, then every 3 months out to about a year, and then every 6 or 12 months after that. We put you on multivitamins, which is generally good for you across the board, and the commonest deficiencies that we see are vitamin D, which is very common in the overweight population, occasionally vitamin A, and very occasionally vitamin B12, but we check those on a regular basis, and I'll advise you if you need any supplements. The main issues to remember about the sleeve are it's an irreversible operation, so there's no going back. There is a small risk of a leak. That's about 1%, and it generally happens in the first 6 weeks. If it does happen, you'll need to be in hospital, and you can be in hospital for 3 to 4 weeks. You'll need drains put in to drain any collections. And that can be done either by myself at surgery or in the X-ray department. We'll treat you with antibiotics, and we'll maintain your nutrition, so that might mean a tube down your nose to feed you or a special drip. If we do that, most leaks heal by themselves. Other things that can happen with the sleeve is occasional bleeding, which very rarely requires any intervention, and a twist or a stricture of the sleeve. That's not very common, but if it did persist, then ultimately you might need converted to a gastric bypass. It should be remembered for patients considering a sleeve that if they have a persistent leak or a persistent problem that's not going away, the only option is for them to go forward to a bypass. Regardless of all this, it is my favourite operation. We're getting excellent long-term results. We have lots of patients who are achieving their goal weight, and we can put you in touch with people who've had the sleeve and have a chat, or you can come to the support group, see some people who are there, and find out what it's like to live with.